Rahim. Today I am going to discuss about diseases caused by Pseudomonas. In the previous lecture, I have discussed the properties of Pseudomonas. If we talk about the pathogenesis, in pathogenesis the first stage is transmission of a pathogen. For this purpose, Pseudomonas aeruginosa is found in soil, water. 10% of the people carry it in the normal flora of the colon, and it is also found in the moist area in the skin. Actually, hospitalized patient can colonize the Pseudomonas aeruginosa on the upper respiratory tract. This organism have the ability to grow in the simple aqueous solution. So actually it contaminate the respiratory therapy, anesthesia equipment, intravenous fluids, and even distilled water. This bacteria is very common in the hospitalized environment, and it causes the nosocomial infection or hospital acquired infection. The reason is that this organism has the ability to grow in water, soil, and hospital equipment, especially intravenous catheter, intravenous fluids, anesthesia equipment, catheters. Due to this reason, this organism is the leading cause of nosocomial infection. The very important property of this organism is that it is an opportunistic pathogen. You know that opportunistic pathogen is that type of pathogen that causes disease in immune compromised person, for example hospitalized patient. And hospitalized patients, especially those patients that have extensive burns. You know that skin is the first line of defense in innate immunity system. When the skin become burn or crack appear in the skin or abrasion appear in the skin, so this defense is when destroyed. Pseudomonas aeruginosa gain the permission to enter the body. Actually, this bacteria is also found in those people that have chronic respiratory diseases, for example cystic fibrosis. Cystic fibrosis is a genetic disease in which the clearance mechanism are impaired. Immunocompromised person having neutrophil count less than 500 per ml of neutrophil count, this bacteria also attacking those people. And you know that those people that using the indwelling catheters, they are also at risk. It causes 10 to 20% of the hospital acquired infection, and the most important infection, that is nosocomial pneumonia, especially in those person they use the ventilator, they cause the ventilator associated pneumonia. Now the pathogenesis is based on the endotoxin. It is gram negative bacteria. The pathogenesis depend on endotoxin, exotoxin, and enzymes. Actually, you know that it's endotoxin, like that of other gram negative bacteria, causes the symptom of sepsis and septic shock. The best known of exotoxin is exotoxin A, which causes tissue necrosis. This toxin inhibit the protein synthesis in eukaryotic cell by ADP ribosylation of elongation factor 2. So when it stop the protein synthesis, it cause the tissue necrosis. It also produces enzymes such as elastase and proteases These enzymes are histotoxic. They cause toxicity of the tissue and facilitate the organism to go to the bloodstream. Thiocyanine actually damage the cilia and mucosal cell of the respiratory tract. You know that cilia and mucosa also considered first line of defense. Cilia and mucosa, cilia have the ability to expel the sputum and microorganism from the body, but thiocyanine damages the cilia and mucosal cell. Mucus are not produced and cilia movement are restricted. So what will happen? Pseudomonas aeruginosa cause the infection in the respiratory tract. This organism has very important system called type 3 secretion system. Actually, you know that type 3 secretion system have the ability to transfer the exotoxin from bacteria directly into the adjacent human cell, which allow the toxin to avoid neutralizing antibody. Type 3 secretion system actually they are mediated by transport pumps in the bacterial cell membrane. This type 3 secretion system have a structure called injectosome, just like the injection, so they directly transfer the exotoxin to the body, and so in this way the toxin is protected from the antibody, or toxin is not neutralized, so it causes the infection. Of the 4 exotoxin known to be transported by this secretion system, XOS is the one most clearly associated with virulence. XOS has several mode of action, the most important of which is ADP, ribosylation of race protein, leading to damage to the cytoskeleton. Now, clinical finding. The clinical finding, the first one is that it causes pneumonia, and those persons that are having cystic fibrosis. It also causes urinary tract infection and wound infection. These 3 infection, UTI, pneumonia, and wound infection, especially in burn patient, they are the most predominant. It can cause disease in every part of the body, but these 3 infection are most predominant. Actually, it causes the pneumonia in hospital acquired. It causes hospital acquired pneumonia, especially ventilator associated pneumonia. From these sites, the organism can enter the blood, causing sepsis, and you know the mortality rate of Pseudomonas aeruginosa sepsis is more than 50%. Now you know the bacteria from blood they spread to the skin, where they cause a black necrotic lesion called ecthyma gangrenosum. This is a ecthyma gangrenosum. This is pseudomonal infection, a skin infection, and this, you know that this infection is having no pus. Ecthyma gangrenosum is a skin lesion caused by the Pseudomonas aeruginosa. In burn patient, Pseudomonas aeruginosa produce a blue-green color of pus in the wound. Actually, it causes cellulitis. It can also cause intravenous drug. It can also cause endocarditis in intravenous drug user. Now, this disease is also found in the severe external otitis. Severe external otitis is the infection of the external ear. This infection is also called malignant otitis externa. Other skin, look at this picture, it is also malignant otitis externa, sometimes involve mastocytid and temporal bone, and also involve ear canal. Pseudomonas aeruginosa is also the common most cause the most common disease in the of the foot in those people who sustain puncture wounds through the sole of gym shoes. The infection is called osteochondritis. Beside it, it also causes a very important disease that is called folliculitis, infection of the hair follicle. Infection of the hair follicle occur in the user of swimming pool. When in the pool they are swimming, they cause the infection. It also causes an important disease called heart tube folliculitis. Heart tube folliculitis is a disease when a person bathing in a tube contaminated with Pseudomonas aeruginosa, and it causes the disease of the hair. So this disease is called heart tube folliculitis. It also causes the eye infection, ocular infection, especially those people they use the lenses. They cause the eye infection or corneal infection. Now talk about this other skin infection. The most important infection is green nail syndrome or pyrrhonichia. What is green nail syndrome? Actually, green nail syndrome is the greenish blue discoloration of the nail. And pyrrhonichia, what is pyrrhonichia? Pyrrhonichia is pyrrhonichia, the infection of the nail, in which the cell between the nail and the cell between the nail bed and nail plate is disrupted. This infection is called pyrrhonichia. It is also, we have discussed it, also called endocarditis. Lab diagnosis. If we talk about the lab diagnosis, Pseudomonas aeruginosa is non-lactose fermenting, so it produces colorless colony on the Mekong agar or AMB agar. It is oxidase positive, so a typical sheen of typical metallic sheen of growth on the TSI agar produce. While on the neutron agar, this is neutron agar, it produces the blue-green pigment. You know that look at the TSI agar. This is Pseudomonas aeruginosa. It is this upper part is called slant. The slant is red. Why? Because it is non-fermenter. Another important feature is that fruity aroma are sufficient to make a presumptive diagnosis from infections. It can also be diagnosed by biochemical reaction. For epidemiological purposes, we also use bacteriophage typing. Now the treatment. Pseudomonas aeruginosa is resistant to many antibiotics, so resistant strain can emerge during therapy. Treatment of choice is anti-pseudomonal penicillin, for example piperacillin, tazobactam, or ticarcillin or cleolinate. Plus you can also give aminoglycosides such as gentamicin or amikacin. In the case of highly resistant strain, you can use colistin or polymyxin E. Drug of choice for urinary tract infection is ciprofloxacin. The drug of choice for infection caused by bacteria Cepacia and Pseudomonas multifida is trimethoprim or sulfamethoxazole. Prevention is simple. Keeping nutritional account about 500 per ml, removing indwelling catheter promptly, taking special care of burn skin, and taking other similar measures to limit the infection and patient with reduced host defenses.